Hi there, my name is Heather Rosenberger, and I'm going to be doing a video to demonstrate the McBurney sign. The McBurney sign is used to help detect appendicitis with clinicians inside a clinic or inside the emergency room when the patient presents with right lower quadrant pain. With appendicitis, there could be some other symptoms as well. Not only having the right lower quadrant pain, they could also have some nausea, some vomiting, maybe even a fever as well. But the right lower quadrant pain is one of the most common symptoms of appendicitis. So, over here in our makeshift emergency room, we have Mr. Jones, our patient here, who is having some abdominal pain. So, hi there, Mr. Jones.
Hello.
My name's Heather, and I'll be your nurse. May I have your full name and date of birth?
Glenn Jones, July 1st, 1955.
May I see your wristband?
Here you go.
What brings you to the emergency room this evening?
Well, I've been having some nausea and some pain in my stomach here.
All right. So let's see if we can figure out what's going on with you. So the McBurney sign, we are going to identify a few landmarks with this patient here. So first, I'm going to pull your shirt up a little bit here. So we're going to find the patient's umbilicus as our first landmark. And then we're also going to use our hands to palpate for the patient's anterior superior iliac spine. So I'm going to press on your abdomen here just a little bit.
All right.
So as soon as you find that spot, and I found it right here, the anterior superior iliac spine, or the ASIS, what you're going to do afterwards, you are going to make an imaginary line connecting the patient's umbilicus to the ASIS. And you're going to go and travel from the umbilicus to 2/3 of the way down. And that's going to be the approximate location of the patient's appendix. And you are going to press on that area with a little bit of moderate pressure. So, Mr. Jones, I'm going to put some pressure here on your abdomen.
Okay.
I want you to let me know if you have any discomfort, all right?
All right. Ooh, ow. Yeah, ow. That hurts.
That hurts when I press there?
Mm-hmm.
Okay. So, like I said, 2/3 of the way down between the umbilicus area and the ASIS is the patient's appendix, which is a finger-shaped organ on the bottom of the patient's colon. Appendicitis, it is one of the most common causes of abdominal pain. It's caused by the inflammation of the inner lining in the appendix. That is the result of the patient having an obstruction of the appendiceal lumen. There could be a few different reasons a patient might be having some obstruction. One of the common causes, for example, it could be some fecal matter, or in some cases as well, the patient could have some worms that is causing an obstruction and a blockage in the lumen of the appendix. So, if the patient has some rebound tenderness, some pain, when you're pressing on that part of the patient's abdomen, that's a positive McBurney sign. So our patient, Mr. Jones here, he had some discomfort, so that was a positive test. If he didn't have any pain or discomfort when I was pressing on that part of his abdomen, then it would have been a negative test. But since it was a positive test, we are going to be doing a few additional tests on this patient here. For example, we're going to be drawing some lab work. We're going to be doing some imaging of him, like a CT scan. And we're also, for women, we're going to be doing an HCG test because when a patient has appendicitis, it becomes a medical emergency to where the appendix needs to be removed. If it's not removed, the patient's appendix can become gangrenous, necrotic, and it can eventually burst inside the patient's abdominal area, and all the contents from inside the appendix can spill into the patient's abdominal cavity, and as a result, that results in a patient getting a really bad infection. The patient can become septic, and that just results in a prolonged hospitalization stay. So for the operating room, they are definitely going to want to make sure a woman is not pregnant, but in the event of a medical emergency, comes a little bit more of a moot point, but it's one of the things we check for. But I hope you enjoyed this video here. Thank you so much for watching. I hope you have a great rest of your day. Bye.